While our attention has been focused on the coronavirus pandemic, the government has moved ahead with its plans for a national health insurance. Currently, the bill is undergoing public consultation, and a private hospital group says this proposed system poses several threats to healthcare in the country. Is this protecting a company's profits or a real warning sign of what's to come? Well, health economist Professor Alex van den Heever has been following the NHI process closely over the years, and he speaks to us now. Prof, with COVID, so many people have been saying in the private and public spheres that we did not cope well in the early days of COVID. How on earth are we going to take on NHI?
The NHI proposals are deeply problematic on a number of fronts. The one is the institutional framework that's proposed, and the other is that the fiscal framework, I'm afraid, is just absurd. And the problem really is that it presumes to replace two pre-existing systems with a single system that doesn't exist. And there's been no appraisal of it, no real analysis, and it doesn't appear that the National Department of Health actually has the expertise to even evaluate these things. And while this has been happening, our current system has been deteriorating. And no reforms that are necessary, the needed ones, are actually being focused on. And I think that this is what the COVID crisis has indicated to us, is that we have a very deficient public health system and National Department of Health, and we need to work out why they don't work, and NHI isn't that solution.
I suppose what's interesting too is that this was really a legacy project of the ANC health minister at the time, and in truth, the political elite are using the private medical sphere in order to get their treatment, if not here, then abroad.
Well, it also includes health workers in the public sector. They're all covered by medical schemes. So health systems are actually extremely complex, and reforming them actually requires a very deep understanding of institutional design, accountability mechanisms, governance frameworks at all levels. I have seen no real attempt to get to the heart of what's not working in our health system. So, for instance, the health market inquiry, which would have looked at the profits, for instance, of Mediclinic and many other private sector organizations and made recommendations to address overcompensation and high rates within the private sector, and yet the government has done nothing. And one of the problems with the legacy NHI framework from the previous minister was one of the arguments against the bill that was proposed is that the Minister of Health was effectively appointing everybody into the system, and therefore there was a problematic governance arrangement that allowed for the capturing of a key institution that would procure billions and billions and billions of rands worth of healthcare services. And then we had digital vibes, which showed exactly the risks that the NHI would propose with its governance model. And yet there has not appeared to be any realization of the irony of what has happened there. The very minister proposing it is caught basically interfering in tender processes according to the SIU. So I think that this is exactly what the concern is. Procurement is very much a key risk area in any part of the state, and the NHI is fundamentally a procurement arrangement.
Explain to me, if you could, your idea of how we could possibly find equitable healthcare in this country without going the NHI route.
It's very straightforward. I mean, the equity solutions do not involve procurement. They involve creating pooling mechanisms. Pooling mechanisms don't involve purchasing. So pooling is basically where you distribute resources on an equitable basis. And in many countries, that is done with some form of public structure that can be used. So essentially what you're doing is you're looking at how you share contributions or tax payments in the system and make sure that resources are distributed adequately. That does not require that you take over whole systems. The second issue is that the governance frameworks for public and private sector need to be reconsidered in South Africa and toward a more decentralized system, but with governance frameworks that ensure accountability to the public for performance and that separate politicians from appointment processes and procurement structures. So this is the arrangement that would work in South Africa, has actually been outlined in policy frameworks, and is the direction that is feasible and that we should move in. There is we will not implement an NHI in South Africa. It's not going to happen. And it will be a mess if there is an attempt to do so and we do no other reform of the system in the meantime. So currently we have Johannesburg Hospital, Charlotte and Clare Hospital, has not been repaired after the fire. After how many months? They have done nothing. That hospital is not providing services as it should. It's not providing training to staff and students as it should. We can't even repair a hospital in time with the current system and with the current corrupt structures in place. Those are the things we need to change and understand why they need to change. The NHI bill doesn't look at that at all.
All right, that was health economist Professor Alex van den Heever from Wits University.